Welcome back to Conversations 901 Conversations. It's all about Memphis and the Mid-South. Okay, as we mentioned earlier on the red carpet today, we have Dr. Marye Bernard, and I like to say she's the master. Definitely one of the masters. And she is my go-to doctor for anything and all things HIV. So today, we're going to talk about basically women and HIV. Okay, so Dr. Bernard.
Hello.
Yes,
Hi.
welcome to Conversations 901.
Yes.
Thank you guys for having me. I'm honored. Thank you.
Oh, we're honored. We're honored
Absolutely.
because we've been talking about this for a while. And I said we gotta
Have her
get
on.
Dr.
Absolutely.
Bernard on.
Yes.
So Dr. Bernard, now we watch the TV commercials and they're on all the time.
Mm-hmm.
Yes.
So the question that everybody has is, and I want you to, we're going to go into this, but I want you, after I say this, to first of all start it off with introducing yourself and tell our viewers, who you are and what you do and where you do it.
Okay.
And after that, I want you to talk to us about the statistics, if you will, of women that are living with HIV disease.
Okay. All right. I'll start out by saying I'm Dr. Marye Bernard. I'm the co-owner and a provider at Spirit Health Medical, where we provide primary care to anyone, but we specialize in HIV. Women in HIV, oh my God, you just stepped all over me there. My platform is prevention.
Okay.
I believe that black women are at the greatest risk for developing HIV, for contracting HIV.
Okay.
And they can protect themselves, but most of them don't know it.
Okay.
Because as you say, the commercials don't indicate that it's a problem for women. It looks
Right.
like it's just a
Right.
problem for same gender loving men.
Yes.
Yes.
And that's unfortunate because that's not the only statistics. Yes, 1 in 2 men who have sex with men will be HIV positive, but 1 in 22 black women will be HIV positive. Yes, and then when I look at the statistics for other people, like white women, it's 1 in 200.
Is it as prevalent for white male or female as it is in the black community?
No. As a matter of fact, with the prevalence now, if you look at it like a big pie.
Okay.
About 75% of new cases are in people of color, and that's people brown and black people. Only 25% are in whites. And when you look at those numbers, it's mostly black men, but black women or women of color also impacted too. White people are not nearly as impacted by HIV as black people.
Why?
I knew y'all were going to say that.
Is there a study as to why
Let me tell
that
you-
is the case?
Let me tell you some things that have been impeding. One, the Bible Belt. We don't want to talk about sex.
Yes.
Yes.
We don't want to talk about sex, and we certainly don't want to talk about same gender loving sex.
Right.
That's one. Two, we don't believe the science. We believe our neighbors.
Yes.
We don't believe the science. The science
Right.
is there. We know for sure how not to get HIV, but the neighbors say different, so you do what the neighbors say do.
Right.
And so if you really sum it up, it's lack of education. Because if people were educated about it, then they would do something about it. For example, the Department of Health and Human Services has a campaign called 90-90-90. That's been the goal in ending the epidemic. And ending the epidemic is nationwide, but there are 10 cities in the United States, and Memphis is one of them, that has the highest rates, and where the focus was just honed in just on Memphis. Just on Memphis. A lot of money came for prevention. And so what they suggest is that we get 90% of the population tested.
Okay.
And then of those who test positive, get 90% of them into care.
Okay.
And once we get 90% into care, get them undetectable where the medicines work, because if they're undetectable, they can't transmit this virus.
Okay.
See, undetectable means untransmittable.
Okay.
So we can get people tested, get them into care, get them on medicines, get them undetectable. We can stop this thing
The
in the black.
spread. That's
We can
right,
stop
the
it.
spread.
Yes, and I'm sorry, I just had to tell the whole story.
No, it is fine. But the question I have is, I know you said that to get them tested, but how do you spread that information? Because this is the first time I'm hearing it. So how do you get that out there to make people more aware of these things, to get them tested, to just make them aware of it?
Other than just if you're gay.
Right.
Right, and that's the biggest misconception.
Yeah.
But again, social media is one thing, but there are lots of organizations out there that are trying very, very hard to work at prevention. They are going out, they're going to the clubs, they're going to the malls, they're going places offering tests, offering prophylaxis, condoms, and so forth. And then they are linking them to care. There are people out there. But what you just said is really what symbolizes most black women. You hadn't paid attention because it doesn't pertain to you.
Right.
You're
Right.
beautiful,
Right.
you look good, you
Well, thank
got pretty
you.
stuff. You ain't got to worry about it. That's what you think.
Right.
Yeah,
And
that's what you
that's
think.
the reason why so many black women are not protecting themselves. Did you know you could do that? Did you know it was some medicine that you could,
I had no
girl,
idea.
it's 2 medicines you can take to not get HIV. Like birth control,
What?
we got HIV control.
Wow.
We got HIV control. We have the form of a long-acting injectable, where you get a shot every other month, or you can take daily pills, and not get HIV. Just like birth control pills, you can take your 1 HIV prevention pill every day and your 1 baby prevention pill every day.
Okay, now let's go into the penal, the jail. What do you call that?
The penal system.
Okay, penal system. How much of that is coming from the jail? Because I don't know any woman that has had a husband, boyfriend, or whatever in jail that really don't believe that he may have been compromised. Because they think because they went in straight, they're so bad, nobody can whip them and take anything from them.
Right.
So how much of it, we know there's a lot of incarceration in Memphis. So how much of that do you think is with the women, black women getting infected, has to do with jail?
I don't know if that's a fair question because we're not testing folks as they go in.
Okay.
So
Okay.
we can't evaluate them when they come out because that's not
Oh,
fair.
yeah,
Because some
true.
of them may have went to jail HIV infected. But
Already.
you bring a good point that sex in jails is not the same as sex on the street. Sex in jail is money.
Yes.
It's protection. It's to get along with people.
Oh,
It's
okay.
more than it's not sex in the jails. It's
Okay.
not what we
Right.
call intimate sex.
Right.
Someone may have sex just to keep from getting beat,
That's
Okay.
right.
Right.
or they may have sex with someone because you have some zuzus and I want some.
Right.
So,
It's just different
It's different,
circumstances.
yes. So I'm not sure we can fairly say that, but I will say this, that any woman who loves a man who's been incarcerated, instead of throwing a big party when he comes home, baby, y'all go get tested
Tested.
together
Yes.
and then have the party.